If you have ever looked up Medicare and walked away more confused than when you started, you are not alone. Medicare is one of the most important decisions you will make in retirement and one of the most unnecessarily complicated. Part A, Part B, Part C, Part D, Medigap, Advantage, Original Medicare. Most people turning 65 have no idea what any of that actually means for them. Today, I am going to fix that. In the next 10 minutes, I am going to walk you through every part of Medicare, what each one covers, what it costs in 2026, and how to figure out which combination is right for your situation. No jargon, no confusion, just the information you need to make a smart decision. Let's start from the beginning. Medicare Part A is your hospital insurance. It covers inpatient hospital stays, skilled nursing facility care, some home health services, and hospice care. Here's the most important thing to know about Part A. For most people, it is completely free. If you or your spouse worked at least 10 years, 40 quarters, in jobs where Medicare taxes were withheld from your paycheck, you qualify for premium-free Part A. That applies to more than 99% of Medicare beneficiaries. If you did not work long enough, you can still buy into Part A. In 2026, the premium is $311 per month if you have 30 to 39 quarters of coverage, or $565 per month if you have fewer than 30 quarters. Now, just because Part A has no premium for most people does not mean it has no costs. In 2026, the Part A hospital deductible is $1,736 per benefit period. That is not per year. That is per benefit period, which begins each time you are admitted to a hospital. If you have a long hospital stay, costs go up quickly. Days 1 through 60, the deductible covers your share. Days 61 through 90, you pay $434 per day out of pocket. After day 90, you pay $868 per day from your lifetime reserve days. This is one of the main reasons many people add supplemental coverage on top of original Medicare, but we will get to that shortly. One more important note about Part A. It does not cover long-term care, it does not cover assisted living, and it does not cover most custodial care, the kind of daily help with eating, bathing, and dressing that many people need as they age. This surprises a lot of retirees, so I want to make sure you hear it clearly. Medicare Part A is not a long-term care solution. Medicare Part B is your medical insurance. It covers doctor visits, outpatient services, lab tests, diagnostic imaging, durable medical equipment like wheelchairs and walkers, home health care, and most preventive services. Part B is not free, and in 2026, the standard monthly premium is $202.90. That premium is automatically deducted from your Social Security check, which is why your COLA raise feels smaller than the headline number, as we covered in our last video. In addition to the monthly premium, Part B has an annual deductible. In 2026, that deductible is $283 per year. After you meet the deductible, Medicare pays 80% of the approved cost for most covered services. You pay the remaining 20%. That 20% with no cap is one of the most important things to understand about original Medicare. There is no annual out-of-pocket maximum with original Medicare alone. If you have a serious illness or major surgery, that 20% could add up to thousands of dollars. One more thing about Part B costs. If your income is above a certain threshold, you pay more. This is called the Income-Related Monthly Adjustment Amount, or IRMAA. In 2026, high earners can pay anywhere from $284 to $689.90 per month for Part B, depending on their income from 2 years ago. If you had a high income year due to selling a home, withdrawing from a large retirement account, or other one time events, you may receive an IRMAA notice, even if your income has since dropped. The good news is you can appeal an IRMAA determination if your income has changed significantly. Now let's talk about Medicare Advantage, which is also called Part C. Medicare Advantage is not a separate program from Medicare. It is an alternative way to receive your Medicare benefits through a private insurance company that contracts with the federal government. When you enroll in a Medicare Advantage plan, you still have Medicare, but your coverage is managed by the private insurer rather than the federal government. Medicare Advantage plans must cover everything original Medicare covers, but they often add extra benefits that original Medicare does not provide. Things like dental coverage, vision and hearing care, gym memberships, and over the counter allowances. Many Medicare Advantage plans have low or even zero monthly premiums on top of your standard Part B premium. But, and this is very important, Medicare Advantage plans have networks. You typically must see doctors and use hospitals within the plan's network. If you go outside the network, you may pay significantly more, or the care may not be covered at all. Medicare Advantage plans also have their own deductibles, copays, and annual out of pocket maximums. In 2026, the maximum out of pocket limit for Medicare Advantage plans is $9,350 for in network services. That number sounds high, but it is actually one of the advantages over original Medicare, which has no cap on your out of pocket costs at all. The choice between original Medicare and Medicare Advantage is one of the most important decisions you will make at 65. Neither is automatically better. The right answer depends on your health, your doctors, your prescriptions, and how much flexibility you want in choosing your providers. Medicare Part D covers prescription drugs. If you have original Medicare, Part D is separate coverage you choose from a list of private plans in your area. If you have Medicare Advantage, your prescription drug coverage is usually built in. Part D plans vary significantly in what they cover and what they cost. In 2026, the average monthly Part D premium is around $40 to $50, but that varies widely by plan and by location. There are also income surcharges for higher earners. Similar to Part B, in 2026, Part D surcharges range from $14.50 to $91 per month, depending on income. Here is something important to understand about Part D. Starting in 2025, a significant change went into effect that limits what you can pay out of pocket for prescription drugs under Part D to $2,000 per year. This is a major improvement for retirees who depend on expensive medications. If you are not enrolled in Part D because you do not currently take many prescriptions, be careful. If you delay enrolling in Part D when you first become eligible and you later need it, you will pay a late enrollment penalty. That penalty adds 1% of the national base premium for every month you were eligible but did not enroll. And unlike many things in life, that penalty does not go away. It stays with you permanently. Now, let's talk about the most important timing rule in all of Medicare. You have a 7-month window to enroll in Medicare when you first become eligible at 65. That window starts 3 months before your 65th birthday, includes the month of your birthday, and ends 3 months after. If you miss this initial enrollment period and do not have qualifying employer coverage, you will face permanent late enrollment penalties for both Part B and Part D. The Part B penalty is 10% added to your premium for every 12 months you were eligible but did not enroll. Miss it by 2 years, and your Part B premium is permanently 20% higher. In 2026, that means paying around $40 more per month every single month for the rest of your life. There is one important exception. If you are still working at 65 and covered under an employer health plan, you may be able to delay Medicare enrollment without penalty. But the rules around this are specific, and getting them wrong is costly. My strong advice is this: set a reminder 9 months before your 65th birthday to start learning about your Medicare options. That gives you 3 months to research, 3 months of your enrollment window in which to make a decision, and 3 months as a buffer. Do not wait until you get the letter in the mail. Here is a simple framework to think about your Medicare decision. If you want maximum flexibility, see any doctor in the country, and are willing to pay some out of pocket costs for that freedom. Original Medicare plus a Medigap supplement plan is often the better choice. If you want lower monthly costs, extra benefits like dental and vision, and you are comfortable staying within a network, Medicare Advantage may be the better fit. And if you take prescription medications, make sure whichever path you choose includes solid Part D coverage, either through a standalone plan or built into your Advantage plan. The most important thing I can tell you is this: do not make this decision based on what your neighbor or your sibling chose. Your health, your doctors, your finances, and your priorities are unique to you. Use Medicare's official Plan Finder tool at medicare.gov to compare plans available in your area. And consider speaking with an independent Medicare broker, someone who can show you options across multiple carriers at no cost to you. So, Mochesgi, Medicare does not have to be this confusing. Once someone takes the time to break it down clearly, it actually makes a lot of sense. That is what we are here for at RetireSafe Guide every single week. If this video helped you, please share it with someone turning 65 soon. They need this. Subscribe if you haven't already, and I will see you in the next video. Stay safe and stay protected.